Welcome to the another topic Clinical Parasitology Unit-1, V-1, Clinical Parasitology. Let's start. 1. Amoebae. Entamoeba histolytica. Pathogenesis, causes amoebic dysentery, liver abscesses, trophozoites invade colonic mucosa. Lab diagnosis. Stool microscopy, trophozoites with ingested RBCs. Antigen detection, ELISA. PCR. Serology, for extraintestinal infection. Entamoeba coli. Pathogenesis, non-pathogenic, a commensal organism. Lab diagnosis. Stool microscopy, large, eccentric karyosome, multiple nuclei in cyst. Entamoeba hartmanni. Pathogenesis, non-pathogenic, resembles small e histolytica. Lab diagnosis. O microscopy, size difference is key. Endolimax nana. Pathogenesis, non-pathogenic. Lab diagnosis. Stool microscopy, large karyosome, no peripheral chromatin. Iodamoeba buchlii. Pathogenesis, non-pathogenic. Lab diagnosis. Stool microscopy, large glycogen vacuole in cyst. 2 flagellates. Giardia lamblia. Pathogenesis, causes giardiasis, foul-smelling diarrhea, malabsorption. Lab diagnosis. Stool microscopy, trophozoites or cysts. Stool antigen test. String test, duodenal sampling. Trichomonas vaginalis. Pathogenesis, STD, causes vaginitis, urethritis. Lab diagnosis. Wet mount, motile trophozoites. Culture, Diamond's medium. NAAT, PCR. Trichomonas hominis. Pathogenesis, non-pathogenic intestinal flagellate. Lab diagnosis. Stool microscopy, motile trophozoites. 3 hemoflagellates Leishmania spp. L. donovani, Kala azar. Pathogenesis, visceral leishmaniasis, fever, hepatosplenomegaly. Lab diagnosis. Spleen or bone marrow smear, a mastocytosis. RK39 antigen test. PCR. L. tropica, cutaneous leishmaniasis. L. mexicana, cutaneous leishmaniasis New World. L. brasiliensis, mucocutaneous leishmaniasis. Lab diagnosis. Skin biopsy/smear. Culture, NNN medium. PCR. 4 sporozoans Plasmodium spp. P. vivax, P. ovale, P. falciparum, P. malariae. Pathogenesis, malaria, fever, chills, anemia. Lab diagnosis. Peripheral blood smear, thick and thin. Rapid diagnostic tests, HRP2, PLDH. PCR, confirmatory. 5 Toxoplasma gondii. Pathogenesis, toxoplasmosis, congenital infection, CNS involvement in immunocompromised. Lab diagnosis. Serology, IgM, IgG. PCR, amniotic fluid, CSF. Histopathology, tachyzoites. 6 Intestinal coccidia. Cryptosporidium parvum. Pathogenesis, severe diarrhea, especially in AIDS patients. Lab diagnosis. Modified acid-fast stain, oocysts. ELISA or DFA. PCR. Cyclospora cayetanensis. Pathogenesis, prolonged diarrhea, especially in travelers. Lab diagnosis. Modified acid-fast stain, larger oocysts than cryptosporidium. Autofluorescence under UV. Iosospora belli. Pathogenesis, diarrhea, especially in immunocompromised. Lab diagnosis. Modified acid-fast stain, elliptical oocysts. Autofluorescence. 7 Ciliate. Balantidium coli. Pathogenesis, balantidiasis ulcerative colitis, diarrhea. Lab diagnosis. Stool microscopy, large, ciliated trophozoites or cysts. MCQs. 1. Which protozoan causes amoebic dysentery? A. Entamoeba coli. B. Giardia lamblia. C. Entamoeba histolytica. D. Balantidium coli. Answer, C. 2. Which stage of Entamoeba histolytica is invasive? A. Cyst. B. Sporozoite. C. Trophozoite. D. Oocyst. Answer, C. 3. Which of the following is non-pathogenic? A. Entamoeba histolytica. B. Endolimax nana. C. Giardia lamblia. D. Trichomonas vaginalis. Answer, B. 4. Which parasite has a characteristic glycogen vacuole in its cyst stage? A. Iodamoeba buchlii. B. Entamoeba coli. C. Giardia lamblia. D. Endolimax nana. Answer, A. 5. Which protozoan causes foul-smelling, greasy diarrhea? A. Entamoeba coli. B. Giardia lamblia. C. Plasmodium falciparum. D. Cryptosporidium parvum. Answer, B. 6. The diagnostic method for Giardia lamblia includes A. Skin biopsy. B. Blood smear. C. Stool antigen test. D. Sputum culture. Answer, C. 7. Which is an STD caused by a flagellated protozoan? A. Giardia lamblia. B. Trichomonas hominis. C. Trichomonas vaginalis. D. Endolimax nana. Answer, C. 8. Which of the following is intestinal and non-pathogenic? A. Trichomonas vaginalis. B. Trichomonas hominis. C. Giardia lamblia. D. Plasmodium malariae. Answer, B. 9. The vector for Leishmania donovani is A. Sandfly. B. Tsetse fly. C. Redoviid bug. D. Anopheles mosquito. Answer, A. 10. Which Leishmania species causes mucocutaneous leishmaniasis? A. L. donovani. B. L. tropica. C. L. brasiliensis. D. L. mexicana. Answer, C. 11. Which Plasmodium species is known for producing malignant tertian malaria? A. P. malariae. B. P. falciparum. C. P. vivax. D. P. ovale. Answer, B. 12. Banana-shaped gametocytes are typical of A. P. malariae. B. P. ovale. C. P. falciparum. D. P. vivax. Answer, C. 13. What diagnostic test is most reliable for Toxoplasma gondii in immunocompromised patients? A. Stool microscopy. B. PCR. C. Blood smear. D. Acid-fast stain. Answer, B. 14. Which organism is dangerous for pregnant women due to risk of congenital infection? A. Giardia lamblia. B. Toxoplasma gondii. C. Cryptosporidium parvum. D. Trichomonas vaginalis. Answer, B. 15. Which is diagnosed using modified acid-fast staining? A. Entamoeba coli. B. Giardia lamblia. C. Cryptosporidium parvum. D. Trichomonas hominis. Answer, C. 16. Cyclospora cayetanensis is best visualized by A. Gram stain. B. Modified Ziehl-Neelsen stain. C. India ink. D. Wright stain. Answer, B. 17. Which protozoan shows autofluorescence under UV light? A. Giardia lamblia. B. Cryptosporidium parvum. C. Cyclospora cayetanensis. D. Plasmodium falciparum. Answer, C. 18. Isospora belli can be diagnosed using A. Peripheral smear. B. Modified acid-fast stain. C. ELISA. D. Wet mount. Answer, B. 19. The only ciliated protozoan infecting humans is A. Endolimax nana. B. Balantidium coli. C. Entamoeba histolytica. D. Toxoplasma gondii. Answer, B. 20. Which protozoan appears as a large, motile organism in stool with cilia? A. Trichomonas vaginalis. B. Giardia lamblia. C. Balantidium coli. D. Plasmodium vivax. Answer, C. Subscribe the channel for more video.